Chapter 49, Hypoglycemia, a review from class and the Lewis textbook. Hypoglycemia, or low blood glucose level, occurs when there is too much insulin in proportion to the available glucose in the blood, which this then causes the blood glucose level to drop less than 70. When plasma glucose levels drop below 70, neuroendocrine hormones are released and the autonomic nervous system is activated. Epinephrine release then causes symptoms of shakiness, palpitations, nervousness, diaphoresis, anxiety, hunger, and pallor. Because the brain requires a constant supply of glucose in sufficient quantities to function properly, hypoglycemia can affect mental functioning. The symptoms that are affected are speaking difficulties, visual disturbances, stupor, confusion, and coma. And symptoms of hypoglycemia can mimic those of alcohol intoxication. Untreated hypoglycemia can progress to loss of consciousness, seizures, coma, and death. Hypoglycemic awareness is a condition in which a person does not experience the warning signs and symptoms of hypoglycemia until the glucose levels reach a critical point. Then the person could become incoherent or combative or lose consciousness. This is often related to autonomic neuropathy of diabetes that interferes with the secretion of counter-regulatory hormones that produce these symptoms. Patients at risk for hypoglycemic unawareness include those who've had repeated episodes of hypoglycemia, older patients, and patients who use beta-adrenergic blockers. Using intensive treatment to get tight blood glucose control in patients who are at risk for hypoglycemic awareness may not be an appropriate goal because a major drawback is hypoglycemia. These patients are usually managed with blood glucose goals that are somewhat higher than those of patients who are able to detect and manage the onset of hypoglycemia. Causes of hypoglycemia are often related to a mismatch in the timing of food intake and the peak action of insulin or oral hypoglycemic agents that increase endogenous insulin secretions. The balance between blood glucose and insulin can be disrupted by administering too much insulin or medication, ingesting too little food, delaying the time of eating, and performing unusual amounts of exercise. Hypoglycemia can occur at any time, but most episodes occur when the oral meds or insulin is at its peak of action or when the patient's daily routine is disrupted without adequate adjustments in diet, medications, and activity. Although hypoglycemia is more common with insulin therapy, it can occur with oral meds and it may be severe and persist for an extended time because of the longer duration of action. Hypoglycemia can usually be quickly reversed with effective treatment. At the first sign of hypoglycemia, check the blood glucose level. If it's less than 70, immediately begin treatment for hypoglycemia. If the blood glucose is greater than 70, investigate other possible causes of signs and symptoms. If the patient has symptoms of hypoglycemia and monitoring equipment is not available or the patient has a history of chronic poor glycemic control, then hypoglycemia should be assumed and treatment should be initiated. Follow the rule of 15 to treat hypoglycemia. So when the blood glucose level is less than 70, treating it by ingestion of 15 grams of a simple, fast-acting carbohydrate, such as 4 to 6 ounces of fruit juice or a regular soft drink. Commercial products such as gels or tablets containing specific amounts of glucose are convenient for carrying in the purse or pocket to be used in case of such a situation. Recheck the blood glucose level 15 minutes later. If the value is still less than 70, have the patient ingest 15 more grams of carbohydrate and recheck the blood glucose in 15 minutes. If there is no significant improvement in the patient's condition after 2 to 3 doses of 15 grams of simple carbohydrates, contact the healthcare provider. Because of the potential for rebound hypoglycemia after acute episode, have the patient ingest a complex carbohydrate after recovery to prevent another hypoglycemic attack. Avoid treatment with carbohydrates that contain fats, such as candy bars, cookies, whole milk, or ice cream. The fat in these foods will slow down the absorption of the sugar and delay the response to treatment. Avoid overtreating with large quantities of quick-acting carbohydrate so that a rapid fluctuation to hypoglycemia does not occur. Now remember, the rule of 15 pertains to a patient who is awake and still able to protect their airway. In an acute care setting, patients with hypoglycemia may be treated with 20 to 50 mL of 50% dextrose IV push. Another option, if the patient is not alert enough to swallow and no IV access is available, is to administer 1 milligram of glucagon by intramuscular or subcutaneous injection. An IM injection in a site such as a deltoid muscle will result in a quicker response. Glucagon stimulates a strong hepatic response to convert glycogen to glucose, and it makes the glucose rapidly available. Now, nausea is a common reaction after a glucagon injection. So to prevent aspiration in case the vomiting occurs, make sure you turn the patient on their side until they become alert. Once the acute hypoglycemia has been reversed, explore with the patient the reasons why this situation developed. This assessment may indicate the need for additional teaching of the patient and their family to avoid future episodes of hypoglycemia.